Hi everybody, thank you so much for joining me for today's Health Talk Express, Pressure Down, Controlling Your Blood Pressure. My name is Ashley Hernandez. I'm the Texas A&M AgriLife Extension Health and Wellness Educator. Today's talk is to inform you more about maintaining a healthy blood pressure and also about the Measure, Monitor, and Maintain Guide to Controlling Blood Pressure. This is minister and author of Keeper of Me, Nellie Wuso. She's walking the walk regarding heart health. Her testimony is simple. High blood pressure doesn't have to be a death sentence. If you're diagnosed, you have to make a decision about how you want to live the rest of your life. Do you want to thrive or just survive? I want to thrive. Her story begins at age 20 when she was having frequent headaches. At first, she associated them with her high-pressure job. She would soon learn that she was suffering from high blood pressure, a condition common and more severe in African Americans. With this diagnosis, she was at an increased risk for other health conditions, such as diabetes. Nellie recalls her most difficult challenge was taking her medication every day. She points out, you must be compliant, and you have to pay attention to what you're doing. You can't skip your medication for 2 days, then take a pill and expect it to be effective. Nellie also learned she had to make lifestyle changes to control her blood pressure. This included eating more fruits and vegetables, regular physical activity, lowering her salt intake, and better managing her stress. Through these improvements, Nellie lost 16 pounds and lowered her blood pressure to 111/77, which is in the healthy range. Positive thinking also played a big role in helping her take charge of her health. Just like Nellie, we need to take to heart the importance of putting our health first. As you will learn, maintaining a healthy blood pressure is a way you can make good health a priority. Can you recall the last time you had your blood pressure checked? How many times have you had it tested in the last 6 months? Last year? Or how many cannot remember when you last measured your blood pressure at all? Routinely monitoring your blood pressure is an important practice to prevent high blood pressure, which is also called hypertension. Screening is one of 7 basics of cardiovascular health for adults. Having high blood pressure means that the pressure in your blood vessels is higher than it should be. High blood pressure is a major risk factor for cardiovascular disease and stroke. In the U.S., 1 in 3 adults have high blood pressure. Recent estimates show that 75 million adults over 20 years of age have high blood pressure. Nearly half of those diagnosed with this condition do not have it under control. Uncontrolled hypertension is associated with an increased use of healthcare resources, with $49 billion spent annually in direct and indirect medical expenses. Of the 75 million with high blood pressure, 34.6 million are not controlling their condition, and of those, 11.5 million are not aware that they are hypertensive. Almost 7 million persons aware of their hypertension, but they're not being treated for it. And approximately 16.1 million are being treated for it, but treatment is not adequate. There is evidence showing that awareness of high blood pressure is lowest among persons between 18 to 39 years of age than it is for those over the age of 40. Understanding what your blood pressure readings means is an important part of healthy living. With this knowledge, you can take action to maintain your blood pressure. When you get blood pressure checked, the results show 2 numbers, systolic on the top and diastolic on the bottom. Systolic, which is the top number, is the higher of the 2 readings. This number measures the pressure in the arteries when the heart beats or when the heart muscles contract. Diastolic, which is the bottom number, is the lower of the 2 numbers and measures the pressure of the arteries between heartbeats or when your heart muscles are resting between beats and refilling with blood. Your blood pressure uses millimeters of mercury as its unit of measurement. For example, a systolic reading of 117 and a diastolic reading of 76 is read as 117/76 millimeters of mercury. The U.S. Preventive Service Task Force recommends screening high blood pressure in adults aged 18 or over. A healthy blood pressure should be less than 120 systolic and less than 80 diastolic. Looking at this chart, you can see the different categories of your blood pressure. We have normal, hypertension, high blood pressure stage 1, high blood pressure stage 2, and hypertension crisis. This is when you need to consult your doctor immediately. For normal, it should be less than 120 for your systolic and less than 80 for your diastolic. For pre-hypertensive, 120 to 139 systolic and diastolic is less than 80. High blood pressure stage 1 is systolic from 130 to 139 or diastolic 80 to 89. High blood pressure stage 2 is 140 or higher, or your diastolic will be 90 or higher. The hypertension crisis is going to be higher than 180 for your systolic, and diastolic is going to be 120 or higher. This is important for you to consult with your doctor or emergency services if your blood pressure is in this range. Persons with blood pressure less than 120 over 80 milligrams per mercury are to be screened every 2 years. Yearly screening is recommended for those who are pre-hypertensive or a systolic of 120 to 139 and a diastolic of 80 to 89. Race, age, family history, and genetics are 4 uncontrollable high blood pressure risk factors. High blood pressure prevalence is highest among persons over the age of 60 and African Americans. Research shows that hypertension in U.S. African Americans is the highest in the world, and it's expected to increase. While high blood pressure is more common in seniors and African Americans, younger adults are at increased risk with poor health habits such as smoking, inactivity, and overweight. There are several lifestyle habits to keep your blood pressure levels in a safe range, such as reducing your sodium intake. So eating things that have less salt in them, trying to stay away from adding salt at the table, increase your physical activity. Trying to get physical activity each day, whether it's taking a walk or trying to do some exercises every day, will help also with maintaining your blood pressure. Maintaining a healthy weight is important. Managing your stress. Too much stress can cause our blood pressure to rise. Lowering alcohol intake. Eat foods rich in potassium such as cantaloupe, greens, oranges, and fat-free yogurt. High blood pressure is called the silent killer because it has no warning signs or symptoms, and many people do not know they have it. The only way to know you have it is to measure your blood pressure. Then you can take steps to treat it if it's too high. For myself, I have high blood pressure. I didn't know I had high blood pressure at all until I was going to some doctor's visits because of some other problems, underlying medical issues that I had. When I would go to the doctor, I would end up having really, really high blood pressure and not even knowing anything at all. I felt fine, I felt normal. So making sure to do a blood pressure log kind of helped my doctor and I figure out what was going on with my blood pressure. And to this day, I still have a monitor here at the house that I take steps to make sure I am monitoring my blood pressure. Measure, Monitor, and Maintain is an easy-to-remember 3-step guide in blood pressure control. Measure focuses on knowing your numbers. There are a number of places you can measure your blood pressure. Doctor's office. Checking your blood pressure is a typical routine in most doctor's visits. Discuss with your healthcare provider what your readings mean. Write down your numbers so you can monitor your blood pressure over time. At a pharmacy, many pharmacists offer the use of a machine to measure blood pressure. Read the directions carefully. Most pharmacists are available to answer questions and discuss your results. Record your results and keep track of the changes. I know at some pharmacies, even if they don't have the machine there, you can actually go up and ask the pharmacist and they can check your blood pressure for you. And at home, manual and electric blood pressure cuffs for home use can be purchased at stores or online. Follow the instructions carefully, and some devices actually store the readings for you. For myself, I use an electric blood pressure cuff that goes on my arm, and I write down my log, and I also write it down. I have an app on my phone where I write down my blood pressures. It makes it easier for me, so if for some reason I forget the paper that I wrote down my blood pressures, I know I usually have my phone with me, so I can pull that out to show my doctor when I go to visit as well. To make sure your blood pressure readings are accurate, there are some simple tips to follow. Do not talk or eat during the check. Avoid caffeine and smoking 30 minutes before measuring. Sit with your back supported and both feet on the floor. Do not cross your legs. Wear a short-sleeved shirt or roll up your sleeves so that the cuff is on your bare arm. And remember, certain factors can temporarily affect your blood pressure readings, such as stress, cold temperatures, exercise, and certain medications. Monitor your blood pressure on a regular basis, even if you do not have hypertension. Comparing your current numbers with past results will show you if your blood pressure levels have changed throughout time. There are 3 guidelines on how frequently to monitor your blood pressure. At least a few times a week with those who have high blood pressure, daily measuring for persons under treatment with high blood pressure, yearly blood pressure monitoring for people who do not have high blood pressure. Myself, I did when I first was diagnosed with high blood pressure, I was doing daily measurements, and at that I would do it a couple of times a day. Was at the age of 31 when I was having these health problems with my blood pressure. We noticed some differences in the numbers whenever I was at the doctor's office as to when I was at home, or moments when I was very stressed out. So with monitoring and lifestyle changes for myself, I no longer have to do everyday screenings. Now I'm able to do it a few times a week. Maintaining control of your blood pressure is the final step. Preventing and treating blood pressure depends on lifestyle changes such as physical activity and diet. If you have high blood pressure or are at risk, your doctor may prescribe medication in addition to these changes. Improving health habits is critical to maintain blood pressure in an acceptable range. Regular blood pressure testing, tracking possible changes, and adopting positive lifestyle habits are key activities in the measure, monitor, and maintain 3-step process. The simple guide will put you on the path to taking control of your blood pressure and your health. With 67 million Americans diagnosed with high blood pressure, we can benefit by making it our personal goal to know our blood pressure numbers. Your decision to practice the 3-step guide to measure, monitor, and maintain your blood pressure relates to Nellie Wusso's encouragement that we must believe we are worth it. Oftentimes, demands of family and work, although important, cause us to not make our health a priority. Everyone benefits from following the measure, monitor, and maintain guide. As we discussed today, 1 in 3 Americans have high blood pressure. Many people with high blood pressure go untreated because they are not aware they have this condition. Our regularly measuring and monitoring is a way to avoid delayed diagnosis and medical care. For healthy persons, maintaining a desirable blood pressure depends on routine measuring and monitoring. As I mentioned earlier, high blood pressure is a silent killer. There are no warning signs, so we must regularly check our blood pressure, even when you're young. Blood pressure testing is convenient because you can measure at your local pharmacy, including those at large discount retailers like Walmart. If your doctor recommends testing more regularly, there are also some home blood pressure devices that are reliable and relatively inexpensive. For people who experience what is called white coat hypertension, when your blood pressure is high in the doctor's office, then in other settings, testing at home or pharmacy is a helpful option. White coat hypertension was once thought to be caused by the stress that doctor's appointments can create. Once a person left the doctor's office, the blood pressure would return to normal, and it was thought that there wasn't a problem. However, research today has speculated that persons with frequently experience the white coat hypertension may have an increased risk of developing high blood pressure. In this situation, your doctor may recommend tracking your blood pressure, and this is another reason measure, monitor, and maintain guide is valuable. Earlier when I was talking about my personal experience with high blood pressure, I had said that I had to monitor daily my blood pressure, and at that I was doing it about 2 times a day. This was recommended because when I would go to the doctor's office, my blood pressure was very high. And then whenever I would go home, once I got a blood pressure monitor for myself, the numbers would go down and be a lot different. At the time, I was going through some other underlying medical problems, and whenever I would go to the doctor's office, it would be causing me more stress. So my blood pressure would be even higher. So being able to use the Measure, Monitor, and Maintain guide has been very valuable for myself. Preventing high blood pressure saves money for both the individual and society. In 2010, it was estimated that the direct and indirect cost of high blood pressure was $46.4 million. Direct cost includes the cost of physicians, hospital services, medications, and home health care. Indirect costs are expenses related to lost resources such as potential income, work productivity. While this is the financial impact to society, individuals are financially impacted. Medicines and doctors' costs are often not fully covered by insurance. Travel expenses to the clinic or hospital for treatment and follow-up visits are another expense. I know for myself, I would have to, during that time, have a lot of doctor's visits, so that was time at work I was missing out. Individuals suffer other personal hardships when they are ill. People with chronic diseases are impacted psychologically and socially. These individuals tend to be more stressed, and depression is common. Family and friends are also affected. The care and concern of helping family members or friends deal with sickness is emotionally demanding. Nellie Wusso's personal story is a reminder that we can take charge of our health. If we have a positive attitude like Nellie, we feel empowered and motivated to practice prevention, like checking our blood pressure. As she said, "Do you want to thrive or just survive? I want to thrive." I know for myself, whenever I found out I was having blood pressure issues, I was very young, so at first it was very stressful. I was very upset about it, but after changing my outlook and trying to be more positive about it, I have actually maintained healthier levels, and like I said, I don't have to depend so much on medication or making sure to monitor every single day. I've been able to back down the amount I monitor, as well as feeling empowered, knowing that I'm making healthier choices when it comes to exercise, when it comes to eating healthy. It makes you feel good knowing that you're taking charge of your health. Measure, Monitor, and Maintain are 3 steps that we can all decide to follow, especially when we choose to put our health first, like Nellie. Measure, Monitor, and Maintain is an easy-to-remember guide to prevent high blood pressure. Make it your personal pledge this week to get checked if you don't know your numbers, and if you do, keep track of your blood pressure readings and maintain good heart health. With this presentation, I have uploaded a handout, Take Action, Measure, Monitor, and Maintain, that provides some take-home information from today's talk. There is also a blood pressure log that you can use to track your readings. Our health is important not only to ourselves, but to those we love. Share this resource with your family and friends because the information will also benefit them. Thank you for taking the time today to join me for this Health Talk Express. If you have any questions, you need resources or more information, feel free to email me. I've provided my email address on the last slide. And I also encourage you to check out our Facebook for more information on presentations, information on health, wellness, and also COVID-19. Stay safe and stay healthy, and remember, measure, monitor, and maintain.